Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Monday Health Minutes. Did you know that Valley Health was founded in 1975 with one location? All these years later, more than 40 locations, 150 providers, 800 employees, and we just keep on growing. So we're talking with CEO and President Steve Shattls about the foundation of Valley Health and where we are today. Thanks so much for being here.
Well, thank you, Melanie, and it's really a pleasure to be here. We are so proud of our growth. We started out very small. We got a small federal grant, some visionaries even before I was here. And I've been here 46 years, by the way, and 50 years, and starting with one site, a couple, which I called red, white, and blue providers, because they were provided by the federal government. They were employees of the U.S. Public Health Service, and we started seeing patients. I remember pulling the first trailer to Fort Gay, West Virginia, so we could provide dental services, and bringing on the first dentist. And one of the first dentists we hired is still with us, and he still sees patients at Fort Gay. It's really incredible.
Yeah, the mission has just grown and grown and grown. And as you said, it started with Medicare, moved to dental. Now it encompasses so many different service lines.
We are so grateful. We have behavioral health, and we need so much behavioral health in our communities around here. We do dental, optometry. We also do some things well beyond that. We're outreaching to our communities, dealing with public health issues and community health issues like HIV, and using the medications that are available now to stop Hep C, to cure disease. The 40 sites that we have, not all of them are comprehensive, but one of the things that's so unique about Valley Health as a community health provider, and that differentiates us from everybody else, being a community health provider, we have that integrated service all under one roof. We can have medicine with pediatrics, family medicine, internal medicine, women's health with OBGYN providers, behavioral health, the dental, optometry, and you can one-stop shop at many of our sites. And then we have services that are outreach, like pharmacy, and pharmacy services that complete the care, and completing care is quality care. And if you can get it in the same site and walk out the door and get it with knowledge, you can pay for it. It's not like going to a big box Walmart and getting, you have to pay. We have programs like 340B program.
Lots of things that can help patients and make their lives so much easier.
Sliding fee scales. You know, sliding fee scales for all of our services that allow for anyone to access our care. And our mission's all about accessing care.
Yes, I hear you say that all the time, access to care and getting out in the community. I know Valley Health has grown so much. Where does the future go quickly for Valley Health?
Oh, you know, there's so many things that we can look at. There's communities that are giving us calls all the time about how can we have a health center. We're a community health center, and that key words are community health, and that's an integration of services. So are there other communities that we could go to? Absolutely. We need care in rural West Virginia, and if you read or listen to the news, primary care, access to primary care is very difficult to find, especially outside of Charleston, outside of Huntington, outside of the big hubs in our region.
Steve, thank you so much for being here. We really appreciate all the insights. It's been so interesting to see how Valley Health has grown and where we're going. Thank you so much.
Thank you, Melanie. It's a pleasure.
We'll see you next Monday.